Dear students, Assalamu alaikum. This is your lecture of gross anatomy for first professional students, and we'll start the gluteal region. I am Dr. Kalimullah, demonstrator, anatomy department, GKMC Swabi. Now the lateral rotators of the thigh. In the diagram, in order from above downward, first is the piriformis, second is the gamulus superior, the third is the obturator internus, and the fourth is the gamulus inferior, and the fifth is the quadratus femoris muscle. The piriformis muscle, it arises from the second, third and fourth jointed sacral vertebrae. It inserts upon the greater trochanter present upon the upper end of the femur bone. Its nerve supply is from the sacral plexus, anterior primary rami of the L5, S1 and S2. The blood supply is from the inferior and superior gluteal arteries. Its function is hip lateral rotation. This muscle passes through the foramen, that is called the greater sciatic foramen, through which the well-known sciatic nerve also passes. The sciatic nerve passes underneath this particular muscle, and sometimes this muscle, due to some reasons, goes in spasm and presses upon the sciatic nerve and causes pain in the distribution of the sciatic nerve. The superior gamulus, it arises from the spine of the ischial bone and inserts upon the greater trochanter of the upper end of the femur. It receives its nerve supply from the sacral plexus, the lumbar 5, the S1 and S2 segments. The blood supply is from the inferior gluteal artery, and it is a hip lateral rotator. The inferior gamulus also arises from the ischial tuberosity, and it inserts upon the upper end of the femur bone, the greater trochanter, as it is shown in the diagram. The nerve supply is different from the superior gamulus, and it receives the nerve supply from nerve to quadratus femoris muscle. The blood supply is from inferior gluteal artery as that for the superior gamulus, and its action is also the hip lateral rotator. The obturator internus, it arises from the external border of the obturator foramen of the iliac bone and the obturator membrane. It inserts upon the intertrochanteric fossa of the upper end of the femur, the fossa between the greater and the lesser trochanter. The nerve supply is from the sacral plexus, L5, S1 and S2 segments. The blood supply it receives from inferior gluteal artery, and as the other muscles, it is also a hip lateral rotator and also an abductor of the joint. The quadratus femoris muscle, it is quadrangular in shape as is shown in the diagram, and it arises from the ischial tuberosity of the ischium bone and inserts upon the intertrochanteric crest, and its nerve supply is the nerve to quadratus femoris, and its root value is L4, L5 and S1. The blood supply it receives from medial circumflex femoral artery and internal pudendal artery and the inferior gluteal artery. Its action is hip lateral rotation. Now in the given diagram you can see the iliac bone and the sacral. They form the sacroiliac joint. Below the sacroiliac joint, the iliac bone is converted into a notch-like structure up to the ischial spine. This is called the greater sciatic notch, in which the GSF is written. In the below the ischial spine, up to the ischial tuberosity, is another small notch that is called the lesser sciatic notch. Now, these are notches and will be converted into foramina by bridging of these notches by means of the ligaments. Sacrotuberous ligaments arise from the sacrum and inserts upon the ischial tuberosity. Sacrospinous ligaments, they arise from the sacrum and insert upon the ischial spine. So the area above the ischial spine, above the sacrospinous ligament, is called the greater sciatic foramen, and below the spine of the ischium up to the tuberosity is the lesser sciatic foramen. In these two foramina, the greater sciatic foramen and the lesser sciatic foramen, these are the two important foramina which are the passageway for the structures from behind from the gluteal region into the posterior thigh or the upper limb. Now, after having an understanding of the sciatic foramina, let us know something about the structures they pass through the sciatic foramina, the lesser and the greater sciatic foramen. First of all, we take the greater sciatic foramen. If you recall the study of your lateral rotators, you will find there the piriformis muscle. It was passing through the greater sciatic foramen. Now, these structures in passing through the greater sciatic foramen are divided into two: the structures above and the structures below the piriformis. The structures passing above the piriformis are superior gluteal vessels, that is the artery and the vein, and the superior gluteal nerves. The structures passing below the piriformis are the inferior gluteal vessels and the inferior gluteal nerves. The sciatic nerve, the posterior femoral cutaneous nerve, the nerve to Quadratus Femoris, these all pass through the sciatic foramen. But there are some structures, they pass through the sciatic foramen and re-enter the lesser sciatic foramen and enters the pelvic region again. These are the pudendal nerve and the pudendal vessels and the nerve to obturator internus. These structures, they pass through the sciatic foramen and goes back in the pelvic region through the lesser sciatic foramen. Structures passing through the lesser sciatic foramen. All the structures level with stars and the tendon of obturator internus muscle, they pass through the lesser sciatic foramen and go back to the pelvic region. These structures that passes through the greater sciatic foramen goes on the back of the thigh, and this is the passageway in the gluteal region from the trunk to the lower limb, also called the passageway or the tunnel through which the structures pass to the lower limb from the gluteal region. In this diagram, we can see the structures passing through the greater sciatic foramen. Let us concentrate upon the diagram showing the nerves. You can see the piriformis muscle passing through the greater sciatic foramen. Above the piriformis, you can see the superior gluteal nerve. Below the piriformis, you can see the posterior femoral cutaneous nerve, the sciatic nerve, and the gluteal nerve. These all three nerves, they are passing down on the back of the thigh region to the lower limb. The pudendal nerve is also been mentioned over here, and it passes, it goes back to the pelvic region through the lesser sciatic foramen. In the other diagram, you can see the superior gluteal artery passing above the piriformis muscle through the greater sciatic foramen, and below the piriformis muscle you can see the inferior gluteal artery and the internal pudendal artery. The inferior gluteal artery will go to the gluteal region, and the internal pudendal artery will go back to the pelvic region through the lesser sciatic foramen. Now some clinical conditions about the gluteal region. The Trendelenburg sign. It is due to paralysis of the abductor muscles. The causes are the fracture of the neck of the femur, the hip dislocation, and paralysis of the abductor muscles. The result is inability to abduct the hip joint. The Trendelenburg sign. The patient shows a drop of pelvis when lifting the leg opposite to weak gluteus medius muscle. Normally, both of the glutei muscles, they maintain the normal position, and they do not allow the pelvis to drop. But if the one of the gluteus right or left medius is paralyzed, the contralateral side is dropped, and the patient will adopt a limping gait. The piriformis syndrome. Taut piriformis muscle irritates and compresses the sciatic nerve, and results in pain in the buttocks, refers in line of the sciatic nerve, and this condition is called the sciatica. There used to be pain, tingling, numbness in the buttocks, and the pain is triggered on climbing. This is a diagnostic criteria for the piriformis syndrome. The management or treatment of the piriformis syndrome. These are piriformis stretching, corticosteroids, and the surgical intervention. The piriformis stretching is shown in this diagram. Take the affected side, cross it over the opposite leg, bending affected leg at the knee, and then drawing the knee to the opposite side of the shoulder. This position is called the fair position, in which there is flexion, adduction, and internal rotation of the affected limb. Thank you, students. With this, we have finished our task of today. For till next meeting, wish you have a good time. Thank you.